All right, everybody. Hi, how are we doing tonight? Thank you so much for being here with us and joining us at our Student Life and Student Wellness webinar. My name is Anna Herbert. I am one of the admissions counselors here at Montana State. Before we get started, we have a special event in for you guys tonight. Just a little bit of housekeeping. If any of you are having any difficulty connecting to audio, you can also call in using your phone. This is the number right here. You would be calling 1-855-797-9485 toll free, or a toll 1-415-655-0002. Your access code that you would type in, that is also known as our webinar number, would be 2632-749-5490. Just so everybody is aware too, if you have any friends that are missing tonight's event, or if you're not able to be here for the whole thing, we will be recording this event and then sharing it on our admissions webinar YouTube channel within the next day or two. So you can keep your eyes open for that. One last thing before I turn it over to our special host of the night, Betsy. Throughout this chat, we do have our team of admissions counselors as well as our Associate Director of Recruitment here to answer all of your questions while Betsy is presenting. To chat with our team, if you could please use the Q&A feature. To find this, if you look at the bottom right-hand corner of your screen, you will see 3 dots. Click on that, click on the Q&A section, and then that is a great place where you can keep asking those questions. We will, of course, be saving some of those more popular questions and doing a live Q&A at the end. So without further ado, I'm going to turn it over to our professional herself. I'd love to introduce you guys to Dr. Betsy Asserson. She is our Associate Vice President for Student Wellness. I'll give it to her to take away.
Thanks so much, Anna, and thanks everyone for being here. I'm excited to have some time to chat with you tonight about all the great things that we're doing here at MSU, supporting student health and well-being and student wellness, and the amazing work that we're doing with our amazing students. And please share all of your questions, as she mentioned, and I'm happy to field those at the end and clarify anything and follow up on things that emerge for you as we talk tonight. Or I guess I'm the one talking and you are listening, but encourage that engagement in any way that we can through that chat feature. So let me introduce myself again. I'm Betsy Asserson, and I'm a licensed psychologist and currently serving as our Interim Associate Vice President for Student Wellness. So I'm going to be talking to you about all of the amazing services we offer within our Student Wellness Center. And really more importantly is all of the great things we're doing to support student health and well-being on our campus. I've been here at MSU since 2001 in the Counseling Center and focused on student mental health. And it's really been a privilege for me to be able to work with students and support them in their health and well-being journey as they navigate these developmental stages of coming to college. I didn't think when I set out to be a psychologist that I would spend my career in college mental health, and I have to say it's been really one of the most wonderful things for me to have made that choice and really get the opportunity to work with students and engage with them in this way. So tonight I'm going to just get us started talking a little bit about some of the issues and the things that we think about with college students and health and well-being and the transitions that they face as they enter the university and all of the new things that are available to them. We're going to talk specifically about all of the services we offer within Montana State University's Student Wellness Center, all of our different departments, services we engage in to support holistic health and well-being on our campus. And then, of course, we'll take questions and discussion at the end. So as I said, you know, my career has really been spent in college mental health. And one of the things I've really noticed over the years is that there are some things that have really changed when we think about supporting students and some things that have really stayed the same. And so when we think about this time of transition for our traditional age college students, we really think about some of those common concerns that can come up for them. Of course, starting college is a significant life change, and anytime that we have life changes or stressors, we know that that can lead to challenges with how you navigate things and can be sources of stress for people. Coming to college is a huge one, and so we know those are really common concerns that we see throughout our holistic health and well-being service offerings here. We also know that there are a lot of relationship changes that students face. So, and I would argue that parents and families, guardians, friends all experience those as well. Those relationship changes from coming to college, leaving behind a support system, changes in support systems, navigating new romantic relationships, navigating new aspects of their independence and identity, and how that intersects with relationships. And all of those things can really contribute to how students might experience stress or distress related to that, or struggle to kind of take care of themselves in those ways. So that too can be kind of a common concern that we see students facing as they enter college. We also know that there are new access to substances for many students, and learning how to navigate that. What are the choices they want to make around that? Being informed about those choices, how to do that safely, how to communicate about those choices, also a pretty common concern that we see. When we think about health in particular, we also know that there's this transition from maybe historically having others in their lives help them manage illnesses, chronic condition management, taking them to the doctor, managing medications, all of those things that there's been support around. Now there's a lot more independence with that. And so those can definitely be challenging concerns, both for parents and students, to figure out, like, how is this going to look at a university? What are the resources available, and how can my student kind of manage those things? Another one is certainly thinking about basic needs acquisition. For some students, that continues, maybe was an issue prior to coming to college, but also we're seeing more and more in the college student population that can be a challenge. Learning how to navigate health insurance and getting support around that. We have students who sometimes are facing food insecurity, and so, you know, how to access those resources and get those care. Over on the left, that graphic for us just helps us kind of identify and hold on to all these different dimensions of wellness that we really try to take into consideration when we're thinking about the services that we provide, how we talk about health and well-being on our campus, and how we encourage our faculty and staff and our entire campus community to invest in health and well-being for our students. With these concerns, we also know that this is also a really great time of opportunity for students. So we really view our role within student wellness is to meet students where they are on whatever their path is for health and well-being, and help them maximize these opportunities to build long-term healthy habits, learn how to be a self-advocate, how to access resources. That's not something that just we magically know. And so we really look for opportunities for students to do that. We don't expect them to come here and just know how to do all those things. We really support them in developing those skills. We also meet them with, like, what are their personal preferences? Like, what's important to them? What does health and well-being look like for them? Maybe they haven't had the opportunity to explore that as much for themselves. And so there's some opportunities here to try out new things, take advantage of the opportunities available to them to really engage in that differently. And then finally, just looking at those opportunities for social engagement, learning, and growth. It's such an amazing time in developmental stage for students to start to build those relationships, engage in new things. When I talk to students at orientation, I always encourage them to try one new thing, figure out what those likes and preferences are, and to engage in activities that maybe they haven't had the opportunity to engage in previously. So here at Montana State, the way that we kind of are addressing all of those things, and the one-stop shop, as we like to say, for all of those different things, is our Student Wellness Center. And so this picture down here is all of the staff in that building on our grand opening in our new facility in August of 2024. So it's really been a wonderful time for us to come together in this new facility, and I'll be talking more about that as we go through things tonight. But it really has been an opportunity for us to come together and take a more holistic approach to supporting student health and well-being. Our vision is really a thriving culture of health and well-being here at MSU. And that's what we're striving towards. And we think about that in so many ways, about how can we support students in their community and their environment to hopefully move closer to taking advantage of a thriving culture of health and well-being here at MSU. while our building, and I hope when you come to campus to visit, you really take some time to take advantage of getting a tour of this beautiful space. The building is amazing, and we welcome people in every day. But more importantly to me, and I'd say those of us that work there, is really what do we do in this building, and how are we maximizing the opportunity for students to feel comfortable to access the care and the services that they need, and feel that this is a place for them to belong and to engage. So I'm going to spend a little time here just kind of talking about this continuum. This is what is focused more on a mental health continuum, but we really within student wellness, we take this approach to all of the services we offer and all of the ways that we work with students. So if you think about this continuum from crisis to excelling, we really talk with students about the importance of looking inward and starting to identify for themselves where they might be at in terms of this mental health continuum. And again, we apply that to all of the different things that we do within student wellness. We're not static beings or creature where we're sort of stuck at one of these levels. We might fluctuate in this at different times throughout the day, but certainly at different times throughout our life. Where I started with some of those common concerns when students are coming to college, we know that those points of distress can certainly maybe lead to them being in more that yellow zone, right? Of feeling nervous and irritable. They might be having some anxiety about those things, and that's certainly a normal reaction. We know that students are going to move along this continuum at different times throughout their time at MSU, and we're here to support them in different ways wherever they are on this continuum. So whether they're in crisis or struggling and they need to access some of the clinical services and care that we provide within student wellness, or they're really like in their flow and they're thriving, excelling, and they're looking for more opportunities to connect and to push themselves to do something new, maybe to mentor other students. We have those opportunities as well. So we really try to think about the ways in which we can support student health and well-being in each of these parts of the continuum as students move through their time here at MSU. So this is just a rendering of actually not a rendering, it's a photo of our building from this fall, kind of as we were moving in and opening. And this highlights the 3 different departments that are in our area. So I'm going to move into talking about each of these areas a little bit more in depth. Campus recreation, counseling and psychological services, and student health services. So first off, just talking about who's eligible and who can use this facility, and all of our students are welcome. It's a welcoming, inclusive, accessible space, and there's something for everyone in the space. Students get the health fee and recreation fee assessed when they're taking 7 or more credits to access all of the different services within that space. But if they're taking less than 7 credits, we know sometimes students might start at less than 7, not typically, but sometimes that happens, and they can opt in to pay that fee to also access all of the services in the building. Additionally, we have some low-cost additional services. So as I go through each of the areas, some of this will make a little bit more sense as well. But we like to be clear that there are some additional services outside of kind of those that are covered by paying the fees that are low-cost additional services for students. So they're specifically within kind of our medical area, some of those minor medical procedures or immunizations, our dental services, lab and x-ray services. We have a full pharmacy, which I'll talk about. But those services, like students would still pay for their medications and those sorts of things and can access those services. We also offer outdoor trips and equipment rental through our campus recreation program, personal training and club sports and intramural. So as I'm moving through and talking about some of this, just know that some of these services are low cost, very affordable and accessible students. And you can find more information about those details if you're interested on our student wellness website, looking at those different departments. Okay. So first up is to talk about campus recreation, and their tagline is "Find Your Play." And one of the things I would say, at least for me, that has been really amazing in moving into this new facility and working together with all of my colleagues is really this intersection between recreation, movement, exercise, connecting through engagement in those activities, and how that really serves as our foundation for health and well-being. And so campus recreation, we know, really is kind of, we'll talk about this, but kind of the classic fitness opportunities that people often think of when they think of a recreation center. But I think the piece that's really unique here is that it really also focuses on student engagement and impacting positive academic outcomes, building community. I had the great opportunity to train or to work with all of our student employees within campus recreation as they came back. And they're just an amazing group of students who are so committed and devoted to supporting student development here. Lots of opportunities for student employment within campus recreation. You can see some of the facilities that we have there, whether that's the fitness area or pool or a climbing wall, but lots of opportunities for students to engage, learn those leadership skills, learn how to take on more responsibility, and get trained. Our previous AVP actually got her start in campus recreation as a student employee, and it inspired her to devote her career in that way. So lots of great opportunities there. So diving a little bit deeper into what they do within campus recreation. So certainly fitness is a core area of what they do. And in campus recreation here on campus, we have our traditional cardio opportunities, machines, fitness classes are all a part of this process where students can engage and try a spin class or yoga, Pilates, all of those different things. That's also included when they are a part of the campus recreation facility. Lots of weights opportunities and ways to engage in other with other students. We also have 3 different courts and gym spaces. We also have a multi-activity court for indoor soccer in there. So lots of opportunities for students to engage and get fit. You can kind of see in the rendering in the circle in the top that we also have an indoor walking track. And so that's been getting more in use as the weather has gotten colder. And then in our nicer months, we see lots of students out and about engaging in that as well. But certainly most of those opportunities that students would be looking for fitness are available to them. We also have our climbing wall, which is a 45-foot climbing wall. It is truly spectacular. And I think one of the pieces of that is that it's accessible for all of our students. You don't have to be an accomplished climber to try it. It's beginners are welcome, lots of opportunities for students to learn how to climb, to support each other in climbing. So really focusing again on that student development piece. Similar to that is our ski and bike shop where students can bring their bikes in. Right now it's ski season, so we have students in there waxing their skis, tuning them up, and it's not a drop off and we'll take care of that for you. Again, teaching students how to care for their gear, learning how to do that and manage taking care of that and learning those skills as well. We do have an intramurals program for students who want to engage in some competitive but fun opportunities there as well. So we have 10 different sports. All levels are welcome in that program as well. Really encouraging students to come and be a part of that and engage with their peers who might have similar interests or try something new. Our aquatics program, you can see our pool, we have, it's 4 lap lanes, it has a vortex area, and it's also our students really wanted that area to be more leisurely focused. So there's a screen for students to watch movies while they're in the pool. During Halloween, they did a monster splash and they had pumpkins in the pool and students all watched Jaws and just had like so much fun in that space. So a pretty robust aquatics program as well. Club sports, you can see more there about our club sports program where we have some intercollegiate competitive sports as well, where the range of different sports for students who might want to partake in that. It's a great opportunity for students who are looking for more competitive opportunities for some sports and activities in that way. And then lastly is our outdoor recreation program. And so lots of, I feel like really, again, a wonderful opportunity for students to engage in the outdoors. Those who have lots of experience with that or those who are new to it have the opportunity to engage and to learn about how to do that safely, join other friends and peers who want to get outside in this beautiful area of Bozeman, Montana. We do have an MSU Expeditions backpacking trip for first-year students. So I believe that opens in early March for students who might be interested in going on a backpacking trip, guided backpacking trip with other first-year students. Feedback from that has been really amazing, where students feel like they get to know each other really well prior to the start of classes in the fall. So that's right before the last orientation in August. But also we do outdoor trips, skills workshops. We have a full gear rentals shop where students can rent the gear they need, as well as support on trip planning. So a really robust campus recreation program that tries to incorporate all of the different opportunities that students might want to support themselves in that way. Next up, we're going to talk about counseling and psychological services. So CPS for short. So when the new Student Wellness Center was built, it actually, or when there was discussion about how we want to proceed with building a new facility, there was a lot of student engagement in that process, and really wanted to hear from students, what do they want in this facility? Because they are the ones that paid for it. They assessed themselves a fee to pay for this new building, and so it really is a student-driven building and services as well. And what students said that their number one thing that they wanted in this building was mental health care. So second was the awesome climbing wall, but first it was mental health. And I would say, you know, from as a mental health professional, I would say I've really seen how students and families and have really shifted kind of their understanding of mental health and what it means to take care of mental health. I think we know that many people in our whole country are kind of dealing with that. That's not a new thing, and that we've seen some increases in mental health needs. And we also know there's been some ways in which coming out of COVID for a lot of people, that sort of highlighted for them the importance of taking care of their mental health, maybe in a different way than had previously been apparent to them. For student mental health, we've really seen a shift where students are coming to college more adept at talking about mental health, better able to access services and advocate for that on their own, less stigma for them in accessing services and support. So really it has been, I think our students really have advocated for that and prioritized that. And as we'll see, and we'll talk more about it, you know, our services have expanded to be able to address that as well. So this is the team of counselors at Counseling and Psychological Services this year. And we're a team of licensed mental health clinicians and professionals. We have social workers, licensed clinical professional counselors, psychologists, and then we also have some professional residents and interns who are completing their graduate work. Our office provides short-term counseling services. And for incoming students, I think it's really helpful to know that it can be an opportunity to connect with services here on campus and transfer some of that care from a previous provider. So students who are wanting to do that as they come to campus in the fall, we can sure help them with that. And more students, I think, are pretty open about talking about that and wanting to maybe transition that care. And so we have processes in place to certainly support them in doing that as well. CPS also offers a lot of outreach and prevention work on campus. So that student engagement piece, again, I think is really important here, where our team is out really engaging with students in different ways, providing programming and opportunities for them to learn about mental health and well-being, to maybe demystify counseling a little bit and see the therapists out and about and engage with them maybe in a little bit of a different way. So that part, I think, is a really crucial part of the work that is done out of this office. And then also CPS also leads the suicide prevention programs on our campus. And so that is, I'd say, something that our whole campus engages in, that of course It can't be one office or just the clinicians who are addressing that. We really take a public health approach to suicide prevention, and our campus partners are heavily involved in that, and they take trainings, are aware of how to identify someone who might be struggling at risk, and then know how to refer them and get them the help and support that they need. And so that's kind of an overview of some of the things that we do in that regard. So diving in a little bit more about some of those specific services is that we do provide free and confidential mental health counseling, both in person and telehealth. I'll tell you that 99% of our students want to be seen in person. So I kind of thought telehealth would stick around a little bit more for students, but our students want to be face to face with a person and talking to them in person. So by far, most of our services are in person. One change that I think can be different both for students and parents and family is the confidentiality piece. That's different at this stage. And so students are adults and they have that right to confidentiality. And so both at the counseling center and within student health, that we're not able to disclose information related to how, if a student is accessing services or what those services are. Of course, if a student wants to sign a release to invite others into their care, there's certainly opportunities for them to do that. But that is a little bit different of transitioning to empowering the student to kind of make those choices to access that confidential care and to take advantage of those services. We also offer group counseling sessions, so opportunities for students to really engage with their peers in a supported therapeutic group counseling. And sometimes students might feel like that could be pretty intimidating or scary to do that in a group, but what our feedback really has been that students actually really love that opportunity to connect with other peers and to hear that maybe they're not alone in dealing with what is going on for them. We offer both general groups, but then also some targeted specific groups related to eating disorders or body image. We do some mindfulness-based movement practices to target anxiety and depression. We do some skill building workshops related to building social confidence for students who might have more difficulty engaging with their peers. So some kind of skill-based opportunities there as well. So we offer about 8 to 10 different groups each semester out at the counseling center. We also offer crisis intervention services. So, we know going back to that continuum that I showed earlier, it's a pretty small number of students who might be experiencing crisis, but we definitely want them to get that support and intervention as soon as that is maybe emerging for them. Ideally, we'd be intervening sooner than that, but crises do happen, and we do have students who experience mental health crises here, and so we have daily crisis options for students to access care. We know that our faculty, staff, and other campus partners know how to walk a student to see us and to get them that immediate help if they need it. And so that's an additional service that we offer here. We also offer drop-in services across campus, and this is, I think, one of the great shifts in thinking about how do you make mental health care more accessible to people. And so we have our counselors in different places on campus where a student can just drop in and have a consultation with them and not necessarily be initiating clinical services, which is a great opportunity for students to maybe just ask a really specific question, get advice on something. Maybe they've been nervous to access care for some reason, and they can kind of ask those questions and figure out, do I need counseling or do I need something else? So those services are another way that students can connect with and drop in and talk with counselors. And then lastly, we offer some care management and referral resources, which I like to share at this point just because sometimes people are thinking about, like, if someone wants a longer term type of treatment or they want some sort of specialty care, it can be really daunting to find someone in the community on your own. And so we have a care management and an online referral platform where we can kind of help connect a student with those services in the community. I take that part of my job really seriously, where I don't want to just have someone Google it and find anyone, but really take seriously, like, how do we do a pretty facilitated referral to help someone get to someone who can be helpful for them and meet their needs. So that kind of rounds out some of those core services that we do within counseling and psychological services. Next up is to talk a little bit about our student health services. And so student health, you can see some of the images there. It's a fully functioning kind of clinic that we have, medical clinic here on campus. So this clinic is staffed by nurse practitioners, advanced physician's assistants, physicians, we have nurses, we have kind of the full complement of a medical team within student health services and medical services. And they really provide a broad range of services for healthcare diagnoses and treatment. So starting at the top here where we think about some of those acute care services, same day urgent issues. So students who might wake up and have a sore throat, or they have some sort of kind of acute or urgent need. We can usually see those things within the same day and get the student in to get that more immediate care that they need. But we also do a lot of primary care support. So primary care for us includes looking at a whole host of kind of ongoing healthcare issues that people might have, but also that prevention care is really important. I would say one of the strengths of a student health clinic is really that piece about educating students about healthcare. Like, what does it mean to access healthcare? What are ways to take care of yourself? How to navigate sometimes pretty complex systems? And so that education piece is a part of that as well. But when we think about primary care, certainly dealing with some of those chronic conditions related to asthma, high blood pressure, certainly they see a lot of mental health issues within the student healthcare clinic as well. So they're offering medication support and support around those issues, physicals, annual exams. So lots of those different opportunities. Also offer contraception services and support for students who are wanting to access those services as well. So pretty robust primary care services. We have a full pharmacy, x-ray and lab on site, so students can get those initial things kind of taken care of when they're accessing care within student health. We also, I don't have it on here, but we also offer some travel health support for students. So if they're, traveling in some way, that, the providers within student health can talk with them about what they might need to be considering as they engage in travel. That's an important piece as well, just navigating that and knowing what to think about if you're traveling abroad. We do have some psychiatric service providers within student health. We have a psychiatrist and psychiatric nurse practitioner. They really work closely with the primary care team to provide that consultation and support to them, but they also do some evaluations and medication management for students who might be needing that level of psychiatric care. We do have nutrition and dietetic support as well. So for a lot of students, again, like learning how it could be related to a chronic health condition, or they need some support on that, or they have a new diagnosis that requires some consultation with a dietitian, but also do a lot of prevention and kind of education from that perspective as well. Also support around students who might be struggling with eating disorders and helping them manage that as well within the dietitian. So comprehensive medical care in that way. As I mentioned earlier, there are some services here that would be more of that low cost. So the lab testing, pharmacy, dental services, those things are low cost and they get billed to the student account that a student can then pay in that way and submit to their insurance. And then there is some optional health insurance plan coverage from the Montana University system. Students who come to MSU are required to have insurance. We at MSU do not manage this plan. It's put on from the Montana University system for the whole state universities and colleges, but that's another piece that just to know is available if that's a need that someone might have. And then lastly, within student health is just kind of noting that they have a lot of after hour support is really met from other service providers here within the community. So we do have a hospital nearby to us. They have kind of the full emergency room services. So if a student needs emergency services, we would of course they would go directly to the emergency room for that. We have some other after hours services as well with urgent cares. But our clinic is open, 8 to 5, Monday through Friday. And that's one of the things that students are also kind of learning to navigate is how do you fit in going to an appointment and taking care of those needs too. But we do make sure that students know what are those additional services available to them if they need kind of those urgent services after hours. Okay, well, I'm cruising through my slides here I think I'm going faster on a webinar, so I'm sorry if I've been talking fast, but the last group I kind of wanted to highlight, focused on student wellness, is our health and education programming that we do within student wellness. So when we think about student wellness, certainly there are those kind of going back to like the continuum that we talked about. So being able to provide that care for students who are needing, having health issues or mental health issues or needing that kind of support. We also really want to engage in prevention work and health education and promoting healthy choices. That to me is really where the opportunity lies when we think about providing college health services on a campus. And so for us, that really is the piece that holds all of these different groups together within our new building and within our new model that is really focusing on this more holistic approach to health and well-being. So we really think about the importance of prevention, education, and outreach. And so some of the focus areas for us in that way are alcohol and substance misuse education. We know that access to substances is an important thing that students are trying to navigate and figure out. We also know some students come in and are looking to maintain sobriety or engage in more recovery resources. We also know that some students don't really have much understanding at all about alcohol and how to manage that and make some choices around how they do or do not want to engage in that. And so we provide different classes and opportunities for students to learn about that, and also how to support their fellow students in that if we find that a student might be struggling with that. So those prevention and education resources are provided from this office. We also have safe sex resources and education around contraception, around safe sex and what that looks like, making sure students are educated about that and they know where to go to access those services or to find contraception, which is within obviously the Student Wellness Center. We have all of those services available as well. And lastly, general education on general wellness. So when we think about how do you prevent someone from maybe how do you intervene early and provide those health and education experiences for them? So stress management trainings, helping students identify like what are ways that they want to manage their time to succeed in school, how to have healthy relationships, and what does that look like for them? So general wellness activities are other things that we are promoting and doing out of our student wellness, health education, and promotion programming space. I think it's next week that we're hosting a full student resource fair within the Student Wellness Center where all of the different offices and entities on campus who are really focused on student health and well-being and helping them succeed in college. Early in the semester, we provide kind of an opportunity for students to come through and just remind themselves of all the opportunities there are. It can be a little bit like drinking from a fire hose with so many resources available to them. And so we really want to make it easy for them to engage in different ways and get connected with all of the resources we have on campus. The last area is our basic needs area. And so I talked about this earlier as well, but that this is maybe a growing need that we're seeing not only on college campuses, but in the communities as well. And so we do have, for food insecurity, we have a food pantry available right in the commons area of our new building, and students have been utilizing that and accessing that when they have the need. We're also super committed to the idea that students coming in to access food resources and then also have the opportunity to talk with someone to look at, are there more sustainable or ongoing options to support them in that way, making sure they have access to resources. Maybe it's some referrals to elsewhere on campus to support them as well. They also provide insurance navigation, so navigating what type of health insurance they might want, and getting support on that, as well as other public resource assistance. So that's kind of the broad scope of the different pieces that we do within that area as well. So that's the end of my kind of more formal um, time. And look at that, right on cue. Here's Anna to jump back in and I think facilitate some question and answers if folks have them.
Great. Yeah, thank you so much for that great amount of information there. A reminder to all of our participants today, if you guys have any burning questions that you would like us to address right now, if you click on the three dots in the bottom right corner of your screen and select Q&A, please feel free to input anything there you would like us to discuss. I do have several questions that you guys shared when you registered, though, that we would love to go over. I think first and foremost, Betsy, could you please just discuss again the cost of the Wellness Center for students, whether that's the fitness center, whether those are any of the healthcare services?
Yeah. So again, that would be when students are taking 7 or more credits. That's when they get the fee added to their student account to access those services. There's a recreation fee and a health fee. And so that just automatically shows up on their student account that they're paying with their tuition and fees, all of the different fees that go along with that. If a student is not taking 7, then they can opt in to pay either of those fees. But really important for people to know it truly is accessible for students to be able to get in there and use those things. And it's not like for counseling, for example, it's free, like we're not billing your insurance and you don't pay anything. Sometimes people are like, but is it really? And I'm like, yes, it really is. Like you come in and you see your counselor each week and there's no charge for that. So yeah.
That's great. Since you mentioned counseling too, we had a lot of questions about that. Can you share just a little bit what that process would look like if a student was interested in connecting with a counselor? Is there an estimated wait time that they would have to wait before they're able to go in for that intake or start having those regular appointments?
Yeah, great question. And so for accessing counseling services, we do start with an intake process for students. So they can call us or they can book online an intake appointment. And that's just that opportunity for a student to meet with a counselor and to talk through what's going on for them individually and how it helps us know like how to get them assigned to work with an ongoing counselor that's a good fit for them. So that's the entry point for that process. People can get in for an intake usually. Our goal is 5 to 7 days. Most of the year, we're doing that within 3 days. And then again, if anyone's in crisis, they get in, within that same day, of course, immediately. I think one of the great things about that intake appointment too is it provides that opportunity, going back to that student development idea. It provides that opportunity for the counselor and the student to really talk about what is the student wanting and needing and help them make the best choice about what they want for their mental health care. And then we work closely with them to kind of individualize and tailor treatment to meet what their needs are.
Great. And then elaborating on that a little bit more, do you have any advice for a student who has maybe never met with a counselor before but is interested in seeking that support system for the first time?
Yeah, I mean, the first thing I would say is like it's absolute. I understand it can be scary, but also we know that at least I would say not just here, like this is true all over the country. It's like that college counseling centers are really meant to be an open and accepting place to help demystify and make that a little bit easier for students. So exploring our website is a great way to kind of have maybe a safe way to explore like what are the processes. There's some FAQs on there to just talk about that. But really just taking that step to make the appointment and knowing that then the counselor will kind of take it from there and they'll help guide you through that process of asking you questions and helping you learn about the process, and helping students feel comfortable with that in whatever way they want to access that care.
Great. Absolutely. I guess staying more on the student health side of things, um, could you share a little bit more information on just what the insurance situation is like? We have some students who are just kind of wondering, Is it a problem if they stay on their parents' health insurance plan? Are there options that are available through MSU? You could just go over that a little bit more for the students.
Yeah. So, yes, students can absolutely stay on their parents' plan if that's what they choose to do. So, I think you can stay on on a parent's plan until you're 26. So for many students, I would say that's what they choose to do is they stay on their established plan throughout their time at MSU, and that's great. We don't have a preference for which plan people are on at all. We just are,
Right.
wanting to make sure that students have insurance. If students do not have access or they're not on a current insurance plan, then those are the other options where they can either meet with someone within that basic needs office and learn about, like perhaps they're Medicaid eligible and they can help facilitate that. If someone's interested in the Montana University System Blue Cross plan, they can help them look at that plan. So help them make those choices. But I would say, certainly most people just stay on their insurance. One thing to think about for out of state students is just to make sure you kind of check what that coverage might look like in Montana. I know for some plans that's can be challenging if someone needed a specialist or something like that, or they wanted to access care outside of campus and use their insurance. They would just want to look into that. So just take some time to explore what your plan is and what it would cover in Bozeman if you're coming from out of state.
Great. That is a very good point. Switching gears a little bit, a very common question we had is if you could talk a little bit more about student employment opportunities, whether that is through different healthcare services, whether that is through the fitness center, perhaps some examples of what those student positions could look like, and then also steps that they should take if they are interested in pursuing employment with student wellness.
Yeah. Okay, so student employees are truly awesome. I just have to say we don't have them in the counseling center, and it's because of the confidentiality needs within our spaces. So that's been newer for me to be able to engage with students in that way. And so I think we have like 80 or 90 student employees within the Student Wellness Center. So lots of students, I would say in most of those areas that I talked about. So we hire students to work at the climbing wall and they're helping to train. They're kind of the staff person who's managing the climbing wall, but also helping to train new students on climbing. We have students who work at the front desk checking people in to the recreation center and greeting them and giving tours of the facility. We have students who work in aquatics and maybe they're lifeguarding. We have students who work in basic needs who are learning about how to support students in accessing basic needs services and learning about food pantries and what that looks like, food insecurity. We have students who do more kind of health education, so helping to learn to lead our alcohol and drug classes, or so having conversations with students about safe sex resources and engaging more in that kind of health promotion side of things. And then within student health in the medical clinic, they do have some student workers who are obviously not providing medical care, but kind of greeting students and in that space and supporting students in that way. Um, and then I would say there are other ways for students to just be involved, maybe not employment, but like we have an Active Minds chapter, which is focused, a student club that's focused on um, mental health. And so students might choose to be involved in that way and doing more education and being involved more broadly with student health and well-being outside of an employment setting. So if a student is interested, we post all of our positions on Hire a Bobcat, and that's where
Great.
students can find those positions and apply. They can also reach out to me or any of the directors within student wellness just if they want to learn more.
Great, thank you. And if one of my counselors wouldn't mind sharing the link to hireabobcat.com in that chat, just so our students have a chance to explore that, that would be great. Thank you, guys. All right, let's see what else we have here. Another one too, would you be able to explain a little bit more the difference between intramural and club sports and what a student should do if they are interested in participating in either of those?
Yeah. So I would say go to our website. They have great information, and then maybe someone wants to put that on there too. Anna, on the student wellness
Absolutely.
website might be helpful because a lot of this information is there as well. But intramurals are, typically they're not trying out for intramurals. People can sign up. All abilities are welcome. It's competitive within other kind of teams here at MSU. I think we have 10 intramural sports right now. So, that's a great opportunity for students who are just looking to have some fun. Maybe they played a sport in high school and they're not really wanting to continue in a competitive way, but they're wanting to be active and engage with peers in that way. They have a ton of fun, I will just say, in intramurals. It's fun to see them engaging with each other in that way. And then the club sports program really is more kind of a step up in terms of competition. And so they'll typically travel for some of their intercollegiate competitions in that way. Last year, our men's lacrosse team was national champions. And so like it's kind of below varsity level sports, but above intramurals in terms of the competition. But they do usually pay some fees to be a part of that, funding their travel, funding their uniforms, all of those sorts of things when they're joining a club sport.
Perfect. Thank you. Another question I got, students were wondering a little bit more about the pharmacy. Just with it being on campus, are they still able to fill any type of prescription essentially there? Are there more limitations?
Yeah, so the pharmacy is again just I think a great opportunity for students to be able to get those medications filled on campus. They also have some over-the-counter options as well. So students who just need, an over-the-counter Tylenol or something, they can stop there and buy that within the pharmacy. Makes it really easy when you're in the building and on campus. Students can also like transfer their prescriptions from their current pharmacy to the MSU pharmacy. And so then they can just get those filled right here on campus and have access in that way. Um, you asked me something else specific, Anna, about that. And now I'm blanking on the other part of your question.
Yeah, just about accessibility and if
Oh,
there are any limitations to what they
I
can get,
mean,
but I
the
think you got
I
it.
don't know if there could be some like really specialty drugs that might be, but the pharmacist there would help the student figure out like how to navigate that if for some
Great,
reason they couldn't fill that. So they would certainly support the student in that as well.
great. And then a couple final ones, just from your own personal experience in your role. Is there any advice that you have for parents or anything that you have seen that can really help parents support, or on the flip side, actions that you've seen that kind of hinder a student's wellness while they're in school here?
Yeah, that's a great question. And we spend some time talking about that, when we do parent orientation in the fall, because I do think that is a critical piece. We do a survey every couple of years of our whole MSU population focused on mental health. And one of the things that it talks about is like, who would you go to if you were struggling or if you were having a mental health concern? And honestly, friends, parents, and family continue to be at the top of that, which I take is like really wonderful because that really shows the importance of that support system that students have. So the advice I typically give to parents is like, um, continue to engage with your student and to move towards them and having those meaningful discussions. You can ask them how's class, and they're going to say it's great. How are your friends? Fine. But dig a little deeper and invite that deeper conversation with them to really understand what's going on because they still need you. They just need you in a little bit different way. So it's a dance, like how you find that space to let students become more independent, but you're still there for them. And every dynamic is different in how they navigate that, but you still know your kid really well, and they still, look to you for that support. In terms of things to avoid, I don't know if I'd call it things to avoid, but things to be thoughtful about is like having conversations before they come to college. So, like having the conversation, what would you do if you're struggling? Where would you go? And starting to instill those skills and opportunities with students now. And like talking openly about like, I want to be here for you. And, I'm not gonna smother you and be texting and calling every day, but like what's going to work for us? What do you need? And here's what I'm thinking, and have those open conversations. Now's the time to start talking about those things to really set them up to have that smooth transition.
It's great. Yeah, I really like how you phrase that. Kind of on the flip side of that, then, from the student experience, do you have any tips just for students that are hoping to maintain their self-care, their wellness habits as they're going through that transition from high school to college?
Yeah. Um, so I would say, it does start now in terms of thinking like really intentionally about how are you taking care of yourself. And so um one of the things I always encourage people to do is to bring with you the tools you know that work for you. Like don't leave those behind, bring them with you. Like if it's making sure you're connecting with your peers or your friends or your family, is it going for walks? Is it if you're an animal person and you're not having an animal here, how are you going to create the opportunity to be around animals? Like start thinking about what are the things that work for you, bring those and do those things. But also, this is an opportunity to try something new. So if you've never taken a yoga class, go ahead and try that. Maybe that's going to be a great way for you to manage stress. If you've never gone on an outdoor um, backpacking trip. Maybe you want to try that and learn something new that way. So I would say it's this balance of bringing what you know works, but taking advantage of all of these opportunities to try something new as well. And the other thing is really, I can't say enough about we're learning more and more about the importance of sleep. And truly, like that is critical. And there are all these myths about college and college students and sleep. And I would say it's not normal to like stay up all night, actually. And so making those plans to like, how are you going to manage that and having those conversations with roommates and things to make sure you're creating your environment to be set up for you to do well in that way too.
Great. Well, I think that kind of hits home on all of the biggest questions that we had today. I want to say thank you so much again for joining us. This was super great and helpful. Just one thing for our participants out there, I did see in your registration forms, we did have a lot of students also asking about housing. We did offer a Living on Campus webinar back in September. I am just going to post a link to this in our chat here in case any of you are interested in also looking at that option. I know we do have our priority housing deadline approaching on January 31st, so that is just another resource for you there. We just wanted to say thank you so much for joining us today. If you guys have any additional questions, please never hesitate to reach out to our office. Our team here in admissions is more than happy to assist you at admissions@montana.edu. For those of you that did not catch this entire presentation, we have recorded this session. It will be posted onto our Webinar Wednesday page on montana.edu, as well as our YouTube page within a couple days. Other than that, thank you so much and have a great night, everybody.